Minister, Preet Court-Gill.
Thank you, Madam Deputy Speaker. I'm grateful for the opportunity to respond to this important debate on the intergenerational impact of diethylestylbestrol, or DES, on women. I want to begin by applauding the perseverance of my honourable friend, the member for Bournemouth West, and the courage of those affected by the impact of DES, including campaigners, many of them women and their families, who have worked for many years to ensure that their experiences are heard and understood. I was honoured to meet some of them earlier today, and I thank them for being here in the gallery, mothers, daughters, on behalf of their sons and granddaughters. On the 5th of November 2025, my right honourable friend, the member for Ilford North, the then Secretary of State for Health and Social Care, issued a formal apology on behalf of the government to all those who have been affected by DES. I wish to reiterate that apology today. At this stage, the government's focus is on carefully considering the available evidence and determining the most appropriate next steps, rather than just simply establishing a public inquiry. Our current work includes ensuring that appropriate clinical pathways, professional awareness and sources of support are in place for those who may have been affected by DES exposure. We have taken action to raise awareness of DES among health professionals. On the 12th of December 2025, Professor Peter Johnson, the National Clinical Director for Cancer, sent a letter to all Cancer Alliance leadership highlighting the effects of DES, asking them to cascade guidance through their clinical networks to help reach appropriate health professionals, including GPs. We have taken steps to improve our knowledge about the impacts of DES. The Department has formally commissioned the University of Exeter through the National Institute for Health and Care Research to undertake a systematic evidence review of the impacts of DES. That is because the current research into DES, as my honourable friend stated, whilst useful, does not yet paint a coherent picture. For instance, existing systematic reviews on the physical impacts of DES across first, second and third generations are relatively dated and have reached differing conclusions. There are also primary research studies that have not yet been incorporated into those reviews, and existing reviews have not fully considered psychosocial impacts, and the newly commissioned review is intended to address those gaps. My honourable friend asked about screening. The research ensures that any future policy on local treatment pathways, clinical guidance and potential screening arrangements is informed by the latest available evidence. It will also be important in guiding decisions on whether a lifelong screening protocol should be developed for individuals affected by DES. Those women affected by DES should of course be involved in this work, and that is why we have made sure that the university will engage members of DES Justice UK so that it can learn from women and some men with lived experience of the effects of DES. I do recognise that the importance of trying to understand the scale of DES exposure and the number of people who may have been affected. The MHRA has taken a number of steps to identify what regulatory action was taken by its predecessor in relation to the risk associated with DES, and these include searches of agency archives, both digital and hard copy, for documentation relating to regulatory activity associated with the use of DES. They have visits to the National Archives to attempt to locate records from the 1970s, including discussions on DES by the Committee on Safety of Medicines, a predecessor to the Commission on Human Medicines, locating previous editions of the British National Formulary and Association of the British Pharmaceutical Industry data sheets, which may detail information on the use of DES. The MRHA also contacted the General Medical Council to establish whether any direct communications on DES had been sent from the GMC direct to healthcare professionals. The GMC could not find any records of communications. And finally, there have been searches of the Yellow Card database for any reports of the use of DES. However, given the time that has passed, I'm sure the House will appreciate the significant challenges in relation to locating and retrieving records from the 1940s to the 1970s. Alongside the steps I have just described, my officials are working to explore what can be done through NHS digital processes in relation to missing or destroyed medical records. In closing, Madam Deputy Speaker, I want to again thank members for raising this very important issue, and I want to pay tribute to all those affected by DES who have continued to campaign for recognition, support and answers. I will.
Way. I'm here because my constituent Helen from Romley came to see me at my advice surgery on Saturday, and I was waiting until the Minister got close to concluding her remarks because I want to understand what is being done and what more the government can do to give information to people who think they may be a DES daughter. Her mum certainly took something during her pregnancy, but it's really difficult to interpret the GP's handwriting on the records that Helen has received. What can the Minister tell Helen and people like her who think probably their health conditions suggest that they are a DES daughter, but they don't yet have the evidence to show that they are?
Can I thank the Honourable Member for her question and pay tribute to Helen? Look, this is really important. My Honourable friend mentioned this issue because whilst there may be 600 women out there, there are many, many more that just do not know, and I'm sure grandchildren too. And it's really important that there is information widely available, not just on NHS websites, but they should be able to go to their GP, and the GP should be able to direct them to a screening service, but equally take seriously the issues that they raise. I think there does need to be more done in this space, and it's certainly something I look forward to working with campaigners and my honourable friend as to what more we can do where we do identify gaps. Madam Deputy Speaker, I just want to pay tribute to some of the women that I met who are sitting in the gallery earlier today. Just hearing directly from them their powerful testimonies really does put a lot of this into context for me, because it's not just about reading about people's stories, but actually that sense of lived experience of what that trauma has been like for many women and their grandchildren and so forth. So can I just pay tribute to Claire Fletcher, Marion and Juliet, Heather and her two daughters, Liam, Charlie and Marie and her daughter and Julia, and apologies if I did miss someone's name, but I just want to say thank you so much for sharing your exposure to DES, and that the healthcare system just did not adequately address the recognised and multi-generational adverse effects of the drug. And we have got to continue to listen carefully to those affected, learn from their experiences, and take every appropriate step to safeguard people now and in the future. This is not simply, as someone said, a historical medical issue. It is about women whose voices were dismissed, whose experiences were doubted, and whose families continue to live with the consequences. And it is just a reminder, Madam Deputy Speaker, that when women say something is wrong, we must listen. We cannot change the past, but we can ensure that their voices shape how we respond. Thank you.